So today we are going over treatment methods for brain cancer. As you can remember, last time we went over treatment methods for pancreatic cancer. But today we are going to be doing brain cancer. Now first up we have the craniotomy. Now the craniotomy is a surgical procedure that requires the removal of a tumor through the making of incisions through the skull. Now before the surgery, patients are required to shave their heads to create a clean and safe area of operation. Now, unlike other surgery, the patient is sometimes kept awake during the procedure. Now, the removal process. The surgeon will usually utilize a saw or drill to cut a selected region of the skull. Now, afterwards, the tumor will be carefully removed. Now, some other information about this procedure can include sometimes after the surgery, the portion of the skull removed will be placed with synthetic material, such as titanium, if said portion is unable to be repaired. Now, after the surgery, the patient will be escorted to the recovery room, where they would typically stay for 3 or 4 to 4 days. Now, next up, we have the biopsy. Now, there are actually around 3 types of biopsy, but in this video, we're only going to be going over 2. Now, first, we have the stereotactic biopsy. Now, this procedure is the more common method when using biopsy for brain tumors. Now during the process, the patient is given a local anesthetic, meaning they are not completely asleep during the surgery, while a stereotactic frame is attached to increase the accuracy of the needle inserted into the skull. Now next up we have the open biopsy. Now this procedure involves the removal of a larger and more noticeable tumor within the brain. Now usually the surgeon makes an incision in the scalp to treat the tumor, and this procedure is also performed during a craniotomy. However, we also have some non-surgical treatments, including radiation therapy. Now that includes stereotactic radiosurgery, also known as SRS, external beam radiation therapy, also known as EBRT, and proton therapy. We also have chemotherapy. As you can see, I attached a diagram to show you how we typically prepare for chemotherapy treatment, immunotherapy, palliative care, hormonal therapy, clinical trials, and also steroids. Now, thank you very much, and I hope you all have a great day. See you next week.